Okay, well, thank you very much, Shana. I'm going to continue the conversation on speech-to-text technology in the MRI environment. So yeah, I'm Nicky Chong-White. I'm a principal researcher at the National Acoustic Laboratories. And I lead the Smart Tech portfolio, and part of what we do in that area is we develop software tools and apps, mostly for clinical and research use in hearing health. And one of them, these solutions uses speech-to-text technology. But the great thing about making technology and making it available for a lot of people to use is that it finds use cases and benefits in situations that we didn't originally plan for. And so I'm really pleased to be part of this group today and speaking on how it can be used in the MRI environment. So as Shana's already covered, the real-world problem with MRI is very loud noise levels. We also have a lack of visual cues, so it's not just the loud noise environment in that space which affects communication. The patient can't see the person speaking, they can't lip read, they don't know when they start and stop speaking. And the intercoms are often of poor audio quality. As we just saw, patients have to remove the hearing devices for the scan, and that all affects the whole experience. So you can imagine, a patient with a hearing loss arrives for the scan, they remove their hearing aids and lie down in the scanner. It's a very unfamiliar and strange environment, and they can't follow what the instructions are. They're unsure what's happening, and maybe they move during the scan, which is going to affect the scan quality. So the result is, a reduced quality scan. So we want to know, how can we improve this experience for both patients, researchers, and clinicians? And it was really great to see how that captioning provided that natural communication. So of course, when communication is challenging, we tend to cut it back to the bare essentials, those key instructions that they have to know, and you drop all that little banter in between, which can help a patient feel more relaxed. The wrong button. Okay, so introducing NowScribe. So this is the app that we've developed at Now. It's a real-time live captioning app. It runs on iPhone and iPad. And we developed it during COVID-19 when face masks were really prevalent, and we are demonstrating that here as well. But when someone's speaking through a face mask, we notice that the voice is quite muffled. You can't lip read, and even I'm a normal hearer, I didn't realise how much I depend on reading lips. I really don't need to in order to hear the audio well, but I think everyone does it, and when that gets taken away, all of a sudden I feel like I can't understand as well. So NowScribe shown here, the key features: it's fast, accurate transcription, it supports over 15 languages, has very large font, it's simple to use. A great thing is that it does on-device transcription. You don't need an active internet connection, and it works offline. And also importantly, it's free. So free to download, free to keep using. There's no subscription costs. So you can just install it and off you go and use it indefinitely as much as you like. Okay, so we originally designed it for use in hearing clinics. But we also found that it has had a lot of increased use in places such as hospitals, in classrooms, and then people have downloaded on their own personal phones for use, family gatherings, social occasions, at work as well. The users have described it as a game changer. It's really good at filling in those missed conversation gaps, confirming what they've heard when they're not quite sure or where they weren't quite paying full attention. But now we're seeing it, growing in use in other cases. So the MRI environment is one of these. And as we saw in the video and in the photos that Shana showed, we've got large captions. Large captions can appear on the screen where the patient can see those lying down through a mirror. And the really great thing is that, there's no disruption to that workflow. Everything can flow smoothly. You can use existing equipment, which is really great. And it provides that additional communication channel that is effective even in sort of a very high noise setting. These are just a few quotes from when we were trialling it in audiology clinics. Especially helpful for people with severe profound loss by giving them reassurance and eliminating miscommunications. I really like this one, a clinician saying it helps us be more holistic in the services we offer. They really just liked being able to offer that, even though not everyone needs it, but just to have that available and always running so that a person doesn't actually have to ask for it, it's just there. And that the captioning improved the flow of the appointment. It saved time. They didn't have to keep repeating, and it just, everyone was just felt more relaxed. So we've seen benefits for use in the MRI case being improved instruction compliance, greater reassurance and clarity for patients. What I really like is the most importantly is that it makes that experience more inclusive and accessible, and that goes to the topic of this roundtable here, so improving diversity and inclusion in this space. So particularly for those with hearing loss, but also, as we'll see, those with English as a second language or their native language not in the same as the person speaking. Also those with speech understanding challenges, auditory processing conditions, or just the fact that it's a really weird environment and, you might be a bit overwhelmed and not really focusing. It's just good to have that reassurance. So the captions don't just help the patient, they help the scan and the whole experience. I just want to highlight some of the advances in speech-to-text, just because I think this is really interesting and this is what I like to do. So you can see in recent speech-to-text or captioning apps, they also do a lot of speech processing as well of the audio signal. So we can see that it might capture the word duration and the pacing of how the speech is spoken. So capitalization for loud speech, stretching out the word, so it's not just sort of like a straight, textbook, very nicely grammar-corrected representation. It is, accurately representing how something is said. We can show emotion, tone, stress using emojis or in brackets the non-verbal descriptors. And now the systems are adapting and learning over time, so they're continually getting better and can train to your voice and the way you speak. You can also use customizable dictionaries, so that's the opportunity to add context-specific terms, maybe names, places, where you want to improve the accuracy. They're not in your standard, vocabulary. The other area we've looked at is creating an augmented reality version of NowScribe that's working on the Apple Vision Pro. It's a AR/VR headset, and what we're doing here is that we use a lot of distributed mics, so everyone's using their own iPhone as a personal microphone, and it means that we can position the captions for each person near their head. So that's really good because also it's hard to see, when someone starts talking or stops talking, it lights up their caption when they start talking after a gap. It has application in group discussions. Maybe, it could be useful for pre-scanned briefings, explaining test results, or in training situations. And so there's just another use of captions which can be used in this field. It also solves the common issues with typical phone-based captions where you have to look down at a screen to read the text and then you miss being able to read the lips or the facial expressions. So yeah, this is another way, a little bit futuristic, but maybe in a few years' time this could be quite common. So yeah, just to finish off, live captions, it's a small technology shift. It really doesn't take that much effort to implement, but it can have a really big accessibility impact. So many of us use captions for, for example, YouTube videos, for Netflix. Why not have them available in real life settings for those that need them? And MRI is just one emerging case, and I really hope to see more coming up. NowScribe is free, it's government funded, designed for impact. We don't take any cut for this. So yeah, if you're looking for a captioning app, go to the App Store, you can download it. And we're proud to contribute to more inclusive and neuroimaging and healthcare. Okay, so thank you.